Hello, everyone, and welcome to the Determinants of Her Health podcast, where we examine the systems that affect women's health and how we can shape them. Today, I have with me Lisa Malia, and we are talking about breast health and specifically dense breast tissue. This is an aspect of women's healthcare that I know virtually nothing about, and I am so excited to be learning with you guys today. And yeah, so we're gonna jump right into it. Lisa, I would love for you to introduce yourself, let us know how you got involved in this, and we can go from there.
Oh, thank you so much, Allie. I'm really excited to be here. It sounds weird to say that talking about dense breast tissue really is like I love every chance and opportunity to, and sometimes I feel like, I talk about it all the time. And so I love when I see the need for this conversation. Every day I meet more people that are telling me, "Oh, I've heard of it, but I don't really know that much about it." And
Yeah.
so thank you for having me. And I think it's such an important conversation to have, that we all be well informed in this area because it affects over 50% of women. So I
Oh,
just commend
wow.
you for putting this show together, and thank you so much for having me.
Awesome. I had no idea it affected that many women. So that's crazy. So
Yeah.
yeah, how did you first how did this world sort of open up for you?
Yeah, thank you. So, I am a mother with three daughters. They're all grown women now. I am a daughter of a woman who has had breast cancer twice.
Oh,
And I was a midwife. My career was in women's health and surrounded by women my whole life that I love and adore, and happened to be a woman who really wanted to be healthy and vibrant and all those things that we hope for ourselves and for our families and our sisters. Um, and I was diagnosed with breast cancer at a fairly young
mhm.
age, at 42, which is just at that screening age.
Yeah.
And what I learned at that time was something called dense breast tissue, which I had never even heard of before.
Yeah.
Or maybe I'd heard of it a little bit, but didn't really give it any sort of significance. Um, and back then, they were just barely starting to notify women, only in some states. There was no federal regulations around this. I
Mm.
was living in California at the time, and they were one of the front leaders in dense breast tissue notifications, where they would have a state mandate to notify women that they have this thing called dense breast tissue. Um, but beyond that, there wasn't any more they had to do about it. Just tell you and confuse you and, not really give you further steps of what that meant and what you should do about it. I was lucky
Mm.
in that I had good care providers, and my radiologist wanted to sit down and talk to me. I had privilege, I had access, I had all those things. And he told me that this dense breast tissue, given my family history, was possibly a problem for reading on my mammogram report, which
Mm.
explained it to me. He said that you are not able to see cancer on a mammogram if you have dense breast tissue. Um, so for those that are listening, that are thinking, yeah, I've heard all this before, I want you to stay tuned, because there's so much more to this. And there
Mm.
is so much that we have learned since then about dense breast tissue. It isn't just that it's hard to see on a mammogram. They know that now it is its own risk factor. So in
Oh,
addition to being a risk factor, and probably one of the strongest risk factors, um, it also makes it harder to read on a mammogram. And I had extremely dense breast tissue. So he said, if you were my sister, I would tell you to go get an ultrasound.
oh, wow.
And then, and then you start realizing, and then he says, it's going to cost you about $400, and it might cost you a little bit extra to have a
Oh,
radiologist read the ultrasound. I was a single mom with kids in school, and I thought, well, this doesn't sound actually that important. You're telling me my mammogram is normal. There's no
yeah.
cancer. I feel like I'm good. He didn't really give me like the full weight and meat of how significantly
Mm-hmm.
this could impair my outcome.
Yeah.
Um, And so, again, with other things that felt more pressing to spend that money on, I was like, okay, well, I'll get to that when I get to it, kind of
Yeah.
an attitude, which wasn't good. Not the right attitude to walk away from that with. But those are the choices we make in an instant, especially when we have other people that are depending on us and we're busy and our days and our lives are just, got to get back to work. Another daycare, another day off, it just
Hmm.
starts to become almost an insurmountable thing when you start thinking about it. And then financially, another copay, or it's fully out of pocket. And there's so many ways that this just becomes, um, even if you have the information, the fortitude to just figure out all the logistics again, right? So it just gets put off or kicked down the road a little bit sometimes if you don't have that sense of urgency behind it.
Yeah.
Um, so finally, I went back about a year later. It started to kind of knot my stomach, and it was time for that
Yeah.
mammogram again. And this time I was like, I'm not walking away without the ultrasound because I was like, this I should have followed my gut a little bit stronger back then, but
Mm.
this time my instincts were talking really loudly to me, and I was like, we need more information. And that is when I got diagnosed with breast cancer, and I was very lucky that we were still able to catch it early.
Yeah.
Um, and the policies have changed. Some of them have changed since then. And that now we do have a national mandate that requires us to inform all women of their dense breast tissue.
Oh, wow. That's
Yeah, I
interesting.
know, right? I mean, this
Yeah.
is thanks to so many people that have worked on this for years. I want to say this is like 10, 15 plus years in the making. Nancy Capello started us off with Are You Dense back, you know, at least 15 years ago. I don't have the exact date
Wow.
on that, but I always want to credit her with getting that going because it was her first website, even back in the day, that was even talking about this. And without me going down that rabbit hole of doing my own research back then and stumbling upon her website, I wouldn't be here today. And that's the honest truth, is just really understanding what this meant and how significant it was led to all the decisions I made later in my treatment, and is the only reason I am sitting here today. And so it's what keeps me up at night, is making sure women have this information to make informed choices.
Yeah.
And this is really key in being able to make some informed choices for yourself.
So what was the deciding factor? You're the founder and CEO of For the Love of Cups. What was the deciding factor that led you to sort of making that big career change and kind of shifting from this is my life experience to this is sort of your mission, I would say.
Hmm. Yeah, because what I found was there wasn't a lot of people talking about it.
Mm,
Um, Nancy Capello at that time was working. She was state by state changing the policy in each state. And like I said, I was lucky that California had adopted that policy to inform women of
yeah,
their dense breast tissue status. Um, and so I basically formed my nonprofit just so I could talk about it nonstop, and I would be
yeah,
able to do that without them legitimately, and nobody would be able to stop me from doing that. Just
yeah.
because I felt, for me, we need these policies to change. They're critical.
Hmm.
And we also need to make sure that there are tools in the hands of patients so that they can advocate for themselves, because policies are so slow to change, slow
Hmm.
to be enacted, slow to bring the providers on board. And so I wanted every woman to walk into that office and not be, gobsmacked the way I was about the information that they were being told, um, to be able to know what to ask, what to look for, and what they would need to do next in a way that made sense for them, in a way that was accessible to them. And so those are the resources and the conversations I wanted to have, was just putting as much information as I could into the hands of the woman walking into that mammogram appointment.
Yeah. So you said that now the policy is that every woman should be informed you have dense breast tissue.
It's always a tongue twister,
Yeah,
yes.
it really is. Where does it go from there? So a woman comes in, she gets her first mammogram, she's told she has dense breast tissue. What is typically the next step? Or is it kind of like, hey, we checked the box, we let you know? Or are they given the tools of, hey, your next step should be an ultrasound or should be some other intervention?
Hmm. Yeah, so this is a great question. And so this is That is now a federal mandate.
Hmm.
And that is the bare minimum that has to be done. There are, at this point in time, I want to say 38 states that have adopted insurance laws that require an
Okay.
insurance company to pay for the supplemental screening, which is huge.
Yeah.
Those are huge wins. Sadly, California is not one of those states. Even though they led the way in
Wow.
notifying women, they are behind in mandating insurance coverage for it. Um, and so what happens there is those that's all great, but they're all varying levels of coverage and different ways about going about it. And so there's still, even if there's that insurance coverage for it, there's still so many ways that there's loopholes and ways to fall through those
Mm,
cracks. And so the Breast Cancer Early Detection Coalition, one of the things that they are advocating for is to have a supplemental mandate that will also require a nationalized standard for that insurance coverage. And so that's something that we are actually actively working on as part of that coalition.
hmm.
And and in the meantime, working with women again on how to advocate to get that paid for, even if they do live in a state. Some people don't know that it should be covered.
Oh, yeah.
If they're meeting the requirements and how to talk to your insurance company about it. If it's not, making sure your providers even know, right? So
Yeah.
there's knowledge gaps
Hmm.
with some of these mandates that are happening. And so these barriers don't even need to exist most of the time, and yet they still persist.
Yeah. That's something that I think anybody who's kind of dipped their toes into healthcare advocacy has seen that, the policies may happen from the top down, but then there's the second step of actually implementing those policies and making sure that all of the stakeholders are aware of them.
Yeah.
And that's where the nonprofits come in or the community-based organizations. And it's so important. I think, having these conversations helps a lot because then more people can understand this is what your rights are. You can go and check and see if you live in one of these states where insurance provides it for you, or is required to cover it.
Hmm.
But yeah, it's always kind of frustrating because you want it to be such an easy win. Like the policy
Yes.
was passed, it was that we checked, we did the thing. Like
Yes.
because that in and of itself is so hard, especially if you're talking about federal policy. Like it is not easy to
Yeah.
get a law passed or even an ordinance or a proclamation. Like it takes a lot of work, a lot of volunteers,
Hmm.
and so kudos to everybody who got that
Yeah.
done because that is huge.
Yeah. Oh, absolutely. It is. It's a huge win because not only that, at the very least, it's brought a lot more people to the table to talk about it. Like I said, I've
Mm,
been talking about it for 15 years and it's felt like I was screaming into a pillow half the time because
yeah,
there wasn't people, it just wasn't on people's radar.
yeah,
But now it is. So when I talk about it, I don't have to start where I used to have to start. We have made progress, and people are really ready to have those conversations now.
that's really cool. So, how can someone know if they have dense breast tissue? And follow-up question, how does it impact people who have breast augmentations, who have implants?
Yeah, these are great questions. I want to back up for a little bit because
Okay.
I would also like to change the way we talk about dense breast tissue, and I'm
Hmm.
gonna bust a couple of the things that I am guilty of, and in fact most of this industry is guilty of, because as we try to explain how to know if you have dense breast tissue and what that means and what how that relates to some of these mandates and recommendations. So what we do have is a current recommendation for women with dense breast tissue who are category C or D to receive a supplemental screening.
Okay.
And what happens there is 50% of women fall into that category of dense breast tissue category C or D. So when you say, how do you know if you have dense breast tissue? If you go into your My Chart, which is such a wonderful tool,
Yeah.
um, it it will tell you, if you look for it, what category your dense breast tissue is, and it will come in A, B, C, or D. So A is mostly fatty, B is some some density, some scattered density, they may even say, or one area of density. And then C, which is more fibrous glandular tissue than fatty tissue, and then D, which is very extremely dense breast tissue.
Okay.
I was in category D
Okay.
at the time of my diagnosis. And so we often, what you hear is 50% of women have dense breast tissue.
Yeah.
So somebody who's category B might go onto their mammogram report and say, well, I have dense breast tissue, but I wasn't referred for supplemental screening.
Mm.
And that's because the current recommendation, and this is what I'm really wanting us all to be more clear about talking about, is that category C and D are the current recommendation for the supplemental screening, which would be a breast ultrasound or a breast MRI. And
Okay.
you need to get those, especially if you're a category C or D. So if you go into your report or you're talking to your doctor, it's important to understand what classification you have, and
Mm.
that will inform how you're able to advocate for that supplemental coverage, or even just the recommendation if you're choosing to pay out of pocket for that screening, the necessity for it. So it's helpful to have that background information as you're looking for it and having those conversations and understanding what the regulations and the recommendations are around it. So, absolutely, I always recommend going into your chart, seeing what they've written up about it, and talking to your doctor, whoever your referring doctor was. And if you get to talk to the radiologist, if you're having a
Mm.
diagnostic mammogram, there should be a radiologist you can talk to. My dream on site would be a woman walks in, gets her mammogram, talks to the radiologist. They tell her her dense breast tissue category, and then she walks right down to the hall for the
Yeah.
MRI or the ultrasound. And this just all happens in one afternoon in a
Yeah.
matter of an hour and a half. And there's not this big gap and delay of care that's happening now.
Yeah. And we can totally get there. I mean, I was a high risk pregnancy, and if my non-stress test didn't look good, went right down the hall, got an ultrasound.
Yeah.
My day lasted a little bit longer, but like you said, the childcare was already taken care of, and it is so important when you're talking about those early interventions and it's so worth it to be able to know what's going on. I mean, in my case with pregnancy, it was like it's worth it for me to waste my entire afternoon in what was going to be a 30-minute appointment is now a 2 or 3 hour appointment. But you know
Yeah.
what? I'm going home and knowing that my baby is safe and that I can
Yeah.
keep being my pregnant self and not worry. And so for a woman to be able to, you know, hey, my day is going a little bit longer at the doctor's than I thought, but I'm not getting that reoccurring appointment and having to schedule the daycare and all of
Mm-hmm.
the things. And then you're going home either feeling reassured or knowing at least hopefully what your next steps are
Mm-hmm.
in order to have the early detection, right?
Yeah.
So yeah, that's incredible. And then is there okay, so this is everybody on the podcast, TMI. So I have implants. So what would someone with implants need to know about this? Is there variation within that as well, or is it just about the tissue of the actual breast?
Yeah, this is actually a really great question and a fair question. So it actually won't affect the reading. They will be able to
Oh,
tell on your mammogram. And a mammogram is the only way to diagnose dense breast tissue.
okay.
And so the implants won't affect that. They will be able to see your breast tissue. They will be able to tell its density, and go through the same process as you would with or without implants. I mean, it might change how they do the
Yeah,
mammogram itself, but it won't change the information that they're able to get from it.
that makes sense. Yeah, I asked my doctor before I had the surgery. I was like, should I do a mammogram now? Like what? And she did not seem concerned at all. So I was like, okay, well, I'm not going to be concerned about this. I'm going
Yeah, yeah, you'll see. I
yeah,
mean, they look different. I mean, you'll see that there's the implant and then there's breast tissue, but you
yeah,
can still, yeah, tell the
yeah.
difference between the two. So,
That's really fascinating. Yeah, it's still crazy that this affects 50% of women, yet it's not something that I'd ever heard of. Maybe I'm totally ignorant to this.
you're
Um,
not. I talk
yeah,
to women in healthcare all the time that don't know anything about it, and it shocks me because I feel like, if they don't know, then, again, it's sort of that moment where I keep thinking, when I found out, if this can happen to somebody like me, then
Yeah.
it must be happening to a lot of women, because I thought I was pretty well informed.
Yeah. And I think that the insurance coverage piece is just so huge because, I mean, $400 out of pocket. And like you said, even just the emotional barrier of I have to do one more thing. I mean, that's a huge deterrence for people. I mean, not a
Hmm.
lot of people can pay an extra $400 to get a screening that they, will justify in their minds to say, like, do I really need this? If there's nothing, then.
Right.
So in
Hmm.
these states where insurance doesn't, it's not required for insurance to cover
Hmm.
it. Are there avenues for women, like say the insurance doesn't automatically cover it, they go and get the ultrasound, it's found that they do have cancer and that this was an early detection. Are there avenues for them to get reimbursed from insurance then, or is it kind of depends on the company?
You know what, that it's going to be very individual,
Yeah.
and what you're able to negotiate with them as far as billing codes and the recommendation, and whether or not they do reimbursements. And they might,
Mhm.
they could potentially reimburse you for that, and it's generally kind of a slower process, but it is possible.
That's very interesting.
Yeah, it's always better to get it on the front end with a good
Yeah.
recommendation from your doctor, and have them negotiate on the front end if you can.
Yeah. Yeah. I mean, we can talk for hours about the whole state of medical insurance in this country, but
Yeah,
it's just
that's another
interesting.
episode.
Yeah, exactly. Um, Great. Well, let's dive into the systems level aspects that are contributing to this. I mean, we already kind of talked about the awareness piece, but what are some ways that you think from like a top-down level we could make it an impact on women being diagnosed with dense breast tissue and then also receiving the early detection of breast cancer?
Yeah, we are approaching that from two areas. I've talked a lot about how, patient information and informed choices is critical. Um, but that's putting so much burden on the patient, right?
Yeah.
And our system really should be doing a better job so that there isn't so much burden on the patient to know all this.
Yeah.
Because you're usually walking into it wishing you had known sooner rather
Yeah.
than later, and we all are typically finding this out the hard way. Um, and so, what we're doing, and what I would like to see, is that scenario that I spoke of a little bit ago, like the experience that you had, where you literally can have this done in one day. You can get
Mhm.
walked down the hall. Right now, there's such a delay of care happening after a person is diagnosed with dense breast tissue to getting that supplemental screening. And I am being bold in saying that it's a delay of care, because I honestly do believe that is what's happening
Mm.
when we talk about early detection saving lives, and all these organizations that say, early detection, and all these pink ribbons that we love to say we're doing such a good job at it, and yet we are letting so many women, and when I say so many, right now our best guess is that only 2 to 3% of these women are receiving the supplemental screening. There is a huge miss in our system
Wow.
of getting everybody back in for that supplemental screening. And that's part of the research that we're doing now. I say best guess because nobody's really tracked it very well.
Mm.
Um, we're looking at research from Canada when we get these numbers. And so that's what we're doing as part of the Clear Pathways program, is bridging that gap in communication after somebody is diagnosed with dense breast tissue. How are we talking to them and getting them back into the office if it wasn't already provided same day?
Yeah.
And how can we tighten up that process to make sure that they aren't rescheduled 6 months down the road after it's, all the phone calls to the insurance company, and after all the wait listing and the back and the forth, right? How could we make this happen in a timely way so that it's meaningful, and accurate, and that we can truly say that we've done a good job of screening this person in front of us.
Yeah.
And for me, that would look like a 6 week window at the most, right?
Mhm.
So that you are able to have this done in a timely way and in a way that makes you feel like you've been accurately screened. Right now, I see women, whether they've got great insurance or whether they are living in situations that are more remote, less access, less insured, are facing many similar barriers in the system in that it's failing in communication once they've been diagnosed with dense breast tissue and the sense of urgency to bring them back. Um, and I think that's where we're really missing the mark there. So when we can work with breast health centers to identify who has the dense breast tissue, who hasn't come back, and how can we reach them? How can we get them back into the door? And so that's where we really want to bridge that gap and make it easy for these women to want to come back, understand the sense of urgency, work with the breast health center. We've got a whole rating platform that we're rolling out so that we as consumers can know who's doing a good job at this, but
Mm,
also give the breast health centers a way to identify what marks they're hitting and how they can work better within their communities to provide that service with more accuracy.
I love that. That's super cool. I'm gonna pause for 1 second
Okay.
because my throat all of a sudden, I'm like kind of getting over a cold. And so
Oh, I know that feeling.
I'm like, I had that tickle in my throat and I was like, it's all gonna go downhill.
I totally get it.
Yeah. Um, okay, we'll jump back in.
Yeah.
Um, I'm thinking about this also from like a technology standpoint. Is there an opportunity for, say, an upgraded ultrasound device or an upgraded mammogram? Also, is there a reason why ultrasound isn't just the first uh, intervention offered, or is there a reason why mammograms are kind of the first line of defense?
Hmm. Yeah, mammograms are the gold standard for
Okay.
screening. They still work really well for many people. Um, and they are the only way to find out if you have dense breast tissue. So it's really, you really do need both,
Yeah.
um, whether it's the ultrasound or the MRI. And there's different nuances to each one of those. And, maybe I'm not an expert, I'm not a radiologist, so I don't want to go too much on that, although I have a pretty good basic understanding of those.
Yeah.
Um, you really do need the mammogram and the supplemental screening,
Mm.
at least initially, to understand. And your density can also change as you age and things change in your body. So it's interesting that it doesn't stay the same. And so there's
Yeah.
some misconceptions around that too, not to further
That's really
complicate
interesting.
things.
Yeah.
But don't assume because you never had it that you don't have it,
Huh.
and know that it can just change over time as well. And our bodies are always changing, so of course
Yeah.
our density might also too.
Yeah.
From
Good.
a technology standpoint, yes, mammograms. There's the 3D mammogram, which
Mm.
is an improvement, but it does not replace ultrasound or MRI. So
Okay.
please know that if you are category C or D, that you
Hmm.
need still, even with a 3D mammogram, the supplemental ultrasound or MRI. And there's lots of innovation happening, trying to make this more accessible in rural communities.
Yeah.
There's people innovating devices that you could even possibly do this from home one day,
Oh,
or
wow.
um, AI bringing into the
Mm.
standard of reading, not to replace a radiologist, but to
Yeah.
help create a standard that is less subjective
Hmm.
when we're looking at scoring dense breast tissue and being able to detect behaviors and patterns and changes in that dense breast tissue more accurately, which is exciting. And so, yeah, there's lots of innovations happening. And one of my key initiatives is to make that sure that those innovations don't create a bigger divide.
Mm.
Because
Yeah.
oftentimes that's what's happening. It's just widening the gap in a gap that's already very wide.
Yeah. I mean, I live in the San Francisco Bay Area, so technology is always like a topic of conversation in this area. But and one of the things I like about innovation is I feel like it can provide its own sort of advocacy because then it sparks the conversation.
Hmm.
Here's this innovation, here's why it's needed. And then everybody who's in that room now has an awareness of, oh, there's an actual problem that needs a solution.
Uh-huh.
But yeah, that's a huge concern. It's one that I have seen with some of these. You talked about at-home devices. There's an at-home NST device, non-stress test device for
Mm.
pregnancy that, um, the biggest use case I can see for this is maternity care deserts. It's those
Yeah.
rural communities. But unfortunately, at least in the beginning of an innovation, those are the people who are the least likely to get access to it. And
Yeah.
it's so unfortunate because that's just the system we live in where these things come out and they're I can't remember the word, but it's not elite, but they're devices that are used for a certain class, the people who can afford it,
Hmm.
and so bridging that gap is huge, and I appreciate that you're
Yeah.
doing that. Can you tell us a little bit more about like what that looks like and how that gap can be bridged?
Yeah, I mean that is the foundation of the Clear Pathways program that we are
Mm.
launching right now. We are still in our market research phase of that, but working directly and starting in San Francisco and Seattle. Those are the two places that we are building out those systems that create that access to really ensure that we're reaching everybody.
Mm.
Whether it's an information gap or if it's an
Mm.
access gap, or a financial gap or a racial gap, right? So there's so many ways that somebody can come up against a barrier there. And so we really want to understand what those are so that we can address them where they're at and get the people back in through the door. And so that's really just building trust within the community. And I think
Yeah.
that what we're doing there is it'll go beyond breast cancer. It'll go beyond screening. It'll, at the end of the day, with so many other women's health issues, we're all talking to the same patient and the same woman at the end of the day most of the
Yeah.
time. And so, where we're able to reach a woman for one thing or a patient for one thing, it'll open up the door for access to so many other things that are in need. And so, once we can really address those gaps, I think that the potential is really quite limitless in that area. And so that's one of the ways that we're doing that with the Clear Pathways program. We have resources on our website that patients can go and download so they can, learn what
Mm.
questions to be asking at their appointment, how to talk to their insurance company if that becomes necessary, and having conversations with their family and their friends, right? So normalizing this, I think everybody knows what a mammogram is now,
Yeah.
so we're taking that conversation to the next level so that there isn't this big information gap.
Yeah. One more question on this systems level. What are some ways that like state departments of health can maybe, are there ways that they can mandate things or create those awareness campaigns? Or have you interacted with the State Department of Health in any way? Is that something that's been helpful or yeah.
This is a great question. We've been more focused on the national mandate and creating a
Mm.
standardized system of care. But absolutely, the state has, like I said, California hasn't adopted a
Yeah.
state mandate for insurance coverage, whereas Washington State has, right? So that's
Yeah.
why we're doing a little bit of that side by side comparison. Um, but every state also does have some resources built in, and so we're not trying to reinvent the wheel. We want to see what already is existing in a community that we could tap into and connect the dots for people to make it easier. And beyond that, like I was saying, I would really like to have another mandate that would require quality of care to be elevated so that we don't have this supplemental screening happening 9, 12 months out by the time they're
Yeah.
due for their next mammogram again, and then the cycle repeats, which is happening more often than not, is that
Mm.
they're just getting pushed down the road for the supplemental screening, and then whoopsie daisy, it's been another year and we're getting a mammogram again, and we still haven't even received the supplemental screening that was recommended a year ago.
Yeah.
And so we'd like to see that come down with the mandate for the supplemental screening to also happen within a reasonable amount of time.
Yeah. So how can people advocate for themselves? Um, Say it's somebody who's, first time getting a mammogram. What is the advice that you would give to that person?
Yeah, I think I one of the first things I ever created was a simple little infographic that was titled Four Questions to Ask at Your Mammogram Appointment.
Oh, that's perfect.
And I can't tell you how many people came back to me and said, I didn't even know I should ask questions at my
Yeah.
mammogram
I've had
appointment.
they ask me the questions and I show up and put
Yeah.
them in the tube and do
Yeah, they
what I
said,
gotta
you
do.
mean I'm supposed to ask questions? And so, I mean, yes, you should ask questions.
Yeah.
And some of them seem obvious, but I think we also get distracted if we're not going in there prepared.
Yeah.
Um, Wondering, number one, do I have dense breast tissue? And do I need genetic testing?
Mm.
Am I high risk? I think there's an assumption that if you don't have a family history that you're not high risk.
Mm.
And so a lot of people go in saying, well, nobody in my family has it. I'm not high risk. They're just kind of doing it to check the boxes and say they did it. And that's actually not necessarily and quite often not the case. In fact, family history is not the biggest risk factor. And not the risk factor that everybody thinks it is in any case. Of course, you want to find out if you should do genetic testing. But you also want to do a full assessment of what your risk factors are. So
Mhm.
I think it's really important to understand your risk factors. So talk about that to your provider. There's different ways they can assess it, and so we can links for any of that in the show notes for people that want more
Yeah.
information. Do I have dense breast tissue? Does my insurance cover supplemental screening? And what does that recommendation look like? So really understanding those four things are key because they get the conversation started. And then it gives you next steps because you don't want to walk away not understanding what your next steps are.
Mm. I love that. Yeah, I mean, I even thought that family history was the number one risk factor because I was like, oh, my mom and grandma have not had breast cancer, so my chances are low, but this is really good because now I will take that mammogram appointment seriously. And
Yeah.
yeah, everybody should hear that. What can you say about the research that has been done, or maybe where the research is lacking just in breast cancer in general?
Oof.
Yeah.
Well, this is a loaded question. Um, I really think there's so much that we don't even know about dense breast tissue. Like I
Yeah.
said in the beginning, when I found out I had dense breast tissue, they just thought that it was something that made it hard to detect breast cancer.
Yeah.
That you couldn't see it on a mammogram because the dense tissue shows up white and the cancer shows up white. So it just looks like a whiteout on a mammogram.
Mm.
Um, and then you know, later on, and I want to say within the last 5 to 10 years, they discovered that breast dense tissue is its own risk factor in addition to being hard to read, which is a huge bit of new information. And
Yeah.
given how prevalent dense breast tissue is, this is a huge miss if we're not looking at this more closely. And then when you start to look in disparities in outcomes once we diagnose somebody with breast cancer, I really want, and this is part of the research that we're advocating for, is to understand this gap and this delay of care in the early diagnosis stages. Who are we really missing? Because we are missing a
Mm.
lot of diagnoses. A lot of women are being diagnosed stage 3 at advanced stages or stage 4 in many cases that had dense breast tissue, whereas we could have caught them early. And this this type of disparity is going to affect Black women and women of color more significantly.
Yeah.
And my understanding is that the Black women have more dense breast tissue. And
Hmm.
so if we aren't really closely looking at that and seeing what those contributing factors to outcomes and survivability are, I we're doing a huge disservice. And I don't want to say even if we're doing that, that is what we haven't done it
Yeah.
yet, right? We can't answer those questions. And I think we really need to be looking at those solutions. And that's where I think we could make a huge impact.
Yeah. There's also a piece of this conversation that could also be a whole nother topic, about just funding for research. Lately we've seen an attack on research on
Mm-hmm.
women's health issues, and to not have that funding for something that is so vital is, I think, really scary. So I'm glad that your organization is looking for the re is, doing the research and advocating for it, because it's really scary to think about how far behind are we going to be and how many people are we going to miss if we're not investing
Mm-hmm.
in the research that will provide these interventions that will save lives.
Yeah.
Yeah. Whole nother topic.
Yeah, exactly.
Yeah.
I mean, and that comes back to what you were saying. And it's fortunate and unfortunate at the same time because this is where the discussion comes with innovation and research and private
Hmm.
funding and so sometimes you have to go that avenue when some of these other things funding sources get cut down or reduced.
Yeah.
And then really being mindful though that you're not just creating more access for people that already have access,
Yeah.
right? So that's where the nonprofits come in, as you said, though.
Yeah. Awesome. Well, this is super helpful. I want to know, how could someone who maybe hears this podcast and they're like, I'm activated. I want to advocate for this. What's something that they could do, just a simple form of advocacy, or organizations that they could join?
Yeah, absolutely. So there's so many wonderful ways to get involved depending on your bandwidth.
Yeah.
Um, there is the Women's Health Advocates and the Early Breast Cancer Detection Coalition. They make it super easy to go to their website and write a letter to your representative and
Mhm.
advocate for any one of these bills. And those actually go a long way. I want to make sure that people understand,
Yeah.
even though it sounds easy, it actually matters. They love those letters and they do make a difference. I've been to the Capitol and I've seen, it's so nice when we walk in to go advocate for something and they already know what we're talking about because they've seen letters and their constituents care about it and they care
Yeah.
about what their constituents care about. So, um, one super easy way to go is go and do that. Two, you can, find me on Instagram or LinkedIn, right? Where I'm always talking about this. And so, supporting what we're doing in any way. I have an advisory board and a steering committee. If you want to get directly involved with what we're doing, if you want to bring this work to your community, to your breast center, we're looking for activated community members all the time and radiologists to partner with, healthcare providers to partner with at every level, every stakeholder involved. So, it's going to take all of us to make a difference. And so I think if you're feeling the call, you're feeling the nudge, there's absolutely a way to get involved.
Hmm.
And then beyond that, we have the Breast Dense Tissue Summit coming up in October and Breast Cancer Awareness Month in the Bay Area. The Breast Density Summit. It's the first of its kind. And so I'm really excited and proud to be launching that. So it'll be the focus of the conversation will be everything that we discussed here. So it sounds like it's hyper niche in the women's health space, this breast dense tissue factor, but the fact that it affects so many
Yeah.
women, it is actually a huge target that we're all missing if we're not looking at the solution here. So
Yeah.
um yeah, and reach out. Like I'm pretty accessible. Send me a message and I'll point you in the right direction if you have any questions.
Yeah. The one great thing about writing letters to your members of Congress about issues like this is that they are hugely bipartisan. And so I would say, from my experience, Congress people are very excited about these issues that will be, that they maybe weren't aware of that they can then support that really don't carry a lot of political burden on them.
Hmm.
I don't know if that's your experience as well, but
Yeah, no, I
yeah.
think this is bipartisan, right?
Yeah.
So you're right. This is one of those issues that can be looked at from both sides of the aisle the
Yeah.
same. And depending on where you value women's health is becomes the issue, but the issue itself does
Yeah.
not seem to be divisive.
Yeah. Which
Yeah.
is there's not a lot of those. So it's great when we
Right.
when we have an easy win. Yeah.
Exactly.
Yeah.
Exactly. I feel like we're the gateway issue.
Yeah.
Yeah.
And I'm sure every single person knows someone who has had breast cancer.
Yeah.
I mean, I can think of 5 people off the top of my head. So, yeah. So to know that this is an issue that has personal ties with so many people too, it opens up so much more of that conversation.
Hmm.
Yeah.
Yeah, and it's important because I think so much of the time, because breast cancer does get a lot of airtime as far as cancers
Mhm.
go.
Yeah.
And so a lot of people feel like they've heard that before or they've seen that before, or,
Hmm.
what about some of these other ones that don't have as much visibility, which do matter and also deserve their own campaigns and advocacy and
Yeah.
attention to. And where this is different is just that it's pointing out where we've really missed the mark in some of
Hmm.
that. We've done a lot of things really well, but we can do so much better
Yeah.
with greater understanding here.
Yeah. And I think too, a lot of times when you get into this mentality of, oh, we've heard about that before, or you guys are taking too much of the stage, it's like there truly is a lot of time and resources and money. Like there is enough to go around, and
Yeah.
try not to have that like resource constrained mindset. And like you said, as we discover so much more, the topic shifts, the
Hmm.
conversation shifts, the needs shift. And yeah, I think that makes complete sense.
Yeah. Yeah,
Yeah.
absolutely.
Awesome. Well, real quick, where can people find you? I know you mentioned it before, but we'll put everything in the show notes, but just tell us where we can find you.
Yeah, thank you so much. I really appreciate that. So, Lisa Malia Norman on LinkedIn, lisamalia.evoke on Instagram. And the website where you'll find the most current resources right now is going to be the breastdensitysummit.org, just
Mhm.
breastdensitysummit.org. There's a resource page there. There's some links to the market research that we're doing where you can go and tell us what your mammogram experiences were like to help us rate some of these breast health centers. Let us know who's doing a good job. Let us know where the gaps are, and what your screenings we're like. That information is invaluable in helping us create these systems. So would really, really appreciate it for anybody to go and take the time to complete some of that for us and for the behalf of the other people in your community. And for the loveofcups.org, that's the parent nonprofit organization that powers all of this. And so there's lots of good blogs and information there. Oh, and one more thing. I will point out
Yeah.
our YouTube channel, Clear Voices
Awesome.
of Hope For the Love of Cups. Some really good interviews there as well.
Awesome. Thank you so much, Lisa. This has been such a pleasure. I think yeah, super important information. I hope tons of people watch it, and please everyone share this.
Mm,
If you don't share the entire podcast, just mention to a friend that, hey, did you know about dense breast tissue?
yeah.
I think we can keep that conversation going. It could potentially save a life.
Absolutely. And with that conversation, yes, talk to your people about it, see what they need to get back for that screening, watch each other's kids, carpool. I don't know,
Yeah.
do what you have to do,
Yeah.
and let's make that happen. Yeah,
Yeah.
absolutely.
If your
Thank you for
friend
that.
comes home from her mammogram and she goes, "Oh, they said I'm a C, I have dense breast tissue, but I'll get to it." You say, "No, you get
Hmm.
yeah, get your
Yeah.
ultrasound and we'll go from there."
Yes, I love that. Thank
Yeah.
you.
Awesome. Lisa, thank you so much. And thank you everyone for watching. As always, please subscribe and share this episode. And I hope you all have a beautiful and healthy day.